What's up, you guys? This is Shay, and welcome back to my channel. If you guys are new to my channel, welcome. So on my channel, I discuss beauty, fashion, try-on hauls, nursing school, just a bunch of different things on my channel. If you guys are interested in what my channel has to offer, please go ahead and hit that subscribe button down below, as well as press the bell notification to be notified whenever I post a new video. So today on my channel, I'm going to be discussing how to do a concept notebook for nursing school, okay? If you guys school has this, good, it's a plus. I'm going to try to go through one of mine and explain to you guys how to do it. If you guys are interested in this video, please stay tuned. Okay, so for a concept notebook, that's when you have, say for instance, they tell you to do it. I did mine this week on stress and coping, okay? My instructor said I can either do it on stress or I can do it on coping because we had two different patients that we did a case study on, so I'm doing mine on stress, okay? So we're going to get started. Excuse me. So we're going to get started. So the patient that I have is a patient, he was involved in a motor vehicle accident, which left him with lower back pain, which caused him to recently lose his job. His girlfriend left him for another person. So now he attempted to commit suicide several times within the last 2 weeks. He also seems moderately depressed, and he's kind of withdrawn to himself. He doesn't really make eye contact. So this is the patient that I'm going to be working with, okay? So just to give a background on the stress, okay? So I just want to tell you about the patient, but really what you're doing is you're going to find, say for instance, see, I'm doing mine on stress. So for the concepts it has for the for the notebook concept, you have these things that you have to answer. You have to answer what is the related concepts, what is the related exemplars. Let's see. You also have to do the related assessments, the related labs and diagnostic tests, the related interventions, related medication, potential complications, and collaborative care, okay? So it depends on what part of the nursing program you're on. Sometimes your school will require you to do two related concepts. Some would tell you to do 4, some 7. It just depends on where you're at in your program and how advanced you are at that time. So my school wanted me to do 7. I'm not going to go through all 7, but I'm just going to show you how to do this. So I'm doing mine on stress, right? So on stress, so the first thing that's related to stress itself, you have to figure out what's related to stress. So what's related to stress, what concept that's related to stress is perfusion, immunity, sleep, cognition, anxiety. What else did I put? Anxiety, sexuality, and sleep, and your mood and affect, okay? So these things affect are related to stress, because if you're stressed out, sometimes you can be stressed, which leads you to have anxiety, right? When you're stressed out, it affects your sleeping, right? When you're stressed out, sometimes it can affect your cognition. It can kind of make you not be able to concentrate, right? Different things like that. It can affect your mood, right? The way that it can affect your mood is sometimes you can be sad, you can be depressed, you can be down. Perfusion, when you're stressed out, sometimes you be so stressed out until you have hypertension, right? And then that can lead to a heart attack and things like that. Immunity, when you're stressed out, your immunity drops. You can be immunocompromised, right? It can lower your immune system because you're stressed out. Your white blood count stress lowers, or sometimes when you're stressed and you have anxiety, anxiety can lead your inflammation to increase. So if you have an increase in inflammation, your immune system is overworking, which can cause your immunity to drop, right? So, as example, I'm going to do the first one. So, the first related concept I said was immunity, right? So, what you have to explain, what is immunity? Immunity is your immune system's um, ability to protect itself from invaded pathogens, like such as cancer, bacteria, any type of infectious diseases, whether it's innate or adaptive, right? Okay, and then so since I put that one, and then the next one, I'm just going to do two more related concepts, right? The next related concept that I put was perfusion. What it You have to explain what is perfusion in your own words. So, what is perfusion? Perfusion is the process of oxygenated blood being delivered to the tissues in your body, right? So that's what perfusion is. The next one that I put was the mood and affect. What is mood and affect? Mood refers to one emotional state, such as the feelings and personality, and your affect is like your expression, right? So these are all put into my own words. So we have to do the related exemplars, right? So the related exemplar connected to immunity was immunocompromised, right? So your immunity is deficient at this time because now you lowered your immune system, right? So with the stress, so your immune system's ability to fight off antigens is compromised, right? With the you have a decrease in effectiveness in your immune system, which impairs your immune system's ability to fight against foreign or abnormal cells that invade or attack it, right? So since you're immunocompromised, so those that is the thing that's related to immunity, right? So the next thing, remember I put perfusion as one of the related concepts. The related exemplar for perfusion is I put an MI, which is a heart attack, a myocardial infarction. So with that, the exemplar for that for myocardial infarction, what is that? What is it? So it can it can occur from a prolonged lack of oxygen supply, which is ischemia to your myocardium, right? So that's what I put for that one. Okay, the next one that I did put was the related for related concept. Remember, was mood and affect. So for that one, I put depression. Depression is related to your mood and affect because remember, you're depressed. It's a mood. What is depression? It's a mood disorder that causes you to feel sad or lose interest in things that you once desired or activities, right? Because you're sad and you have your depression. So those are what I put for that. Okay, so we're gonna move on to related assessments. So what type of related assessments will we do for this one? We would do a health history, right, to explore the patient's current, past, and let me see, I'm sorry, somebody was calling me. So first we would do a health assessment, right, to explore the patient's current and past medical history, any risk factors for depression, any anxious temperament, family history of anxiety, any traumatic experiences that the patient may have experienced. Another thing that we can also assess is physical assessment, which we can check their physiologic changes, as well as are they vital signs, or do they have any indication of self-harm to self, lab tests, things like that, osculate, palpate, different things like that. Another thing that we can do is assess their psychological state. So let's evaluate their psychological state. How is their mental status? How depressed are they? Do they seem like they're at risk for suicide? Do they seem like they want to harm themselves? Do they seem like they want to harm others? Also, do it's called, what is it called, a perceived stress scale. It's like it tests your stress level. What was your stress level within the last week? It's like an instrument that tests, I'm sorry, within the last month. So that's what you can do for that. I put a couple of other things, but I'm not going to go into that. I'm just trying to list a couple of them. So now we're going to go on to the related lab and diagnostic tests. So I put the CBCs. You're going to check their CBCs. You want to get a baseline for their blood level on any patient. You want to always check their baseline baseline blood test, right? You always want to get a baseline. always. So you want to check their red blood cells, their white blood count. You want to check they hemoglobin, their hematocrit. So that's what you want to do. You also want to get a BMP. Um, a basic metabolic panel. You also want to get that to check their fluid balance, their electrolytes, their potassium, kidney function, sodium. Those are basic tests that you want to get. You also want to check their thyroid function. I know it sounds kind of weird, but you want to check that too, because you want to make sure that a lot of people, sometimes people, depression is linked from a hypoactive thyroid, if that makes sense. Um, so you want to check that as well. And also you want to check their cortisol levels, because when people are really stressed, they secrete cortisone from their adrenal glands. So the higher level of your cortisone is how stressed you are. That they can indicate that from that, as well as um, a drug test. You want to check and see if they have any drugs in their system, any alcohol, things like that. Okay, so boom. That's just a couple of things. So related interventions. What are you going to do for this patient? Related interventions. So you're going to provide the patient with encouragement to assist them. So you're going to provide the patient with encouragement and help them assist themselves with self-care, eating, hygiene, different things like that. You're going to try to encourage them, because sometimes when people are depressed, they tend to not want to eat, or they not want to take care of themselves. We don't want to do that. Disheveled hair. It's just, you want to make sure that they encourage them. You want to educate them on depression. You want to show therapeutic communication. You want to do your rounds every 15 minutes if you see that they're at risk for harm to themselves. But just period, you want to do rounds every 15 minutes. You have to straight up ask the patient, do you want to harm yourself? Do you want to harm others? I remember when I worked in a mental health facility, it was kind of hard for me to ask that. At the beginning, I was shy, like, oh my gosh. But no, you have to be straightforward. Do you want to harm yourself? Do you feel like you want to harm others? Like, you have to ask these questions, because we're, at the end of the day, we're trying to save these people lives. We're trying to help them. And just encourage them to express their feelings. Try to get them to participate in group activities, group sessions, things like that. Okay, so the related medications is antidepressants, the SSRIs, the serotonin reuptake, whatever, which is like Prozac, Zoloft. Also anxiety medication, which would be like Xanax, or Valium, different things like that. Also sleeping pills. If they're having insomnia, they need sleeping pills, right? So these are just related medications. Not to say they're going to take every single one of them together. No, these are just medications that are related to what we're talking about. Also sleeping pills related to insomnia, anxiety, which would be like trazodone, Lunesta, things like that. So potential complications, of course, death. My teacher was like, everybody pick death. Of course, death is the number one. Death is number one. So it's death, suicide, non-compliant with treatment, heart disease, weight gain, pain, you know, diabetes, from the weight gain and the stress, because it affects their hormone levels. Okay, so we're finished with that. So that was the potential complications. Lastly, collaborative care. So who's gonna collaborate with this patient? I think it's going to be the medical provider, physician, the nursing staff, the nurses, psychologists, psychiatrists, the patient, of course, the patient's family, if they have family to help them, the pharmacist, of course, with the medication, dietitian. All these things is going to help the patient with their success and their continuity of care. These are all important. So this is just, and make sure if you have any references or anything like that, you make sure you do your in-text citations as well as your reference at the bottom. But I hope that this has helped you. If you guys have any assignments that are called notebook, I'm sorry, it's called concept notebook, because at the beginning I didn't really know what to do, because I came into the program as an advanced student, and I didn't get the basic part of this because nobody ever taught that to me. I had to learn it. on my own. So I just want to help you guys. So if you guys ever have a problem with it, you guys can refer back to this video, even if it's um, a different concept. You can still revert back to this video to help you out. Okay, you guys, if you have any questions, any comments, any concerns, please go ahead and put the comments down below, or email me, anyone. Okay, I hope this video has helped you guys. Have a good day. Peace out.